Hi, Blood Talk fams. Welcome to today's video on hematology in the topic of hemostasis. In this video, we're going to answer some important questions related to blood clotting, platelet productions, and conditions like scurvy. We will cover key topics like the cause of bleeding problems in scurvy, how many platelets a single megakaryocyte produce, what causes thrombocytopenia, the different steps in hemostasis process where platelet help form clots. You will have a better understanding of these essential topics. Let's dive in. What causes bleeding problems in scurvy? The answer is A. Scurvy is a disease caused by a lack of vitamin C in the diet. Vitamin C is important because it helps the body make collagen, a protein that keeps skin, blood vessels, bones, and teeth strong and healthy. When you don't get enough vitamin C, your body can't produce enough collagen, which lead to symptoms like gum problems, bruising easily, weakness and tiredness, joint pain or swollen, dry, rough skin, and hair. Scurvy used to be common among sailors who don't have access to fresh fruits and vegetables during long journey over the sea. But today it's rare because we can get vitamin C from foods like citrus fruit, orange or lemons, strawberries, and vegetables like bell peppers. How many platelets does a megakaryocyte usually produce? The correct answer is D. Platelets are tiny cells that help blood clot, which is important when you get a cut or injury to stop bleeding. A megakaryocyte is a large type of cells in your bone marrow that make platelets. Each megakaryocyte produces approximately 2,000 to 4,000 platelets. The numbers of platelets generated depends on the megakaryocyte. Here how it works. 1. Megakaryocytes are very big cells in your bone marrow. The bone marrow is the soft tissue inside your bones. 2. The megakaryocyte cells does not circulate in your blood, but instead it stay in bone marrow where they break apart into smaller pieces. 3. The smaller pieces are the platelet, which then enter to the bloodstream. Platelets play a key role in clotting. So having a healthy megakaryocyte is important for preventing excessive bleeding. Which of the following does not cause thrombocytopenia? The answer is A, post-splenectomy. After a splenectomy or the removal of the spleen, platelet counts typically increase, not decrease, because the spleen is no longer filtering platelet from the blood. Let's look at each option. B. Chemotherapy. Chemotherapy can damage the bone marrow, which produce platelet, leading to a decrease in platelet production and thrombocytopenia. C. Decreased thrombopoietin. Thrombopoietin is a hormone that stimulates platelet productions in the bone marrow. If the level of thrombopoietins are low, platelet productions will decrease, which can cause thrombocytopenia. D. Aplastic anemia. Aplastic anemia is a condition where the bone marrow fails to produce enough blood cells, including platelet, leading to thrombocytopenia. In the hemostasis process, what is the term of platelets sticking together? B. Aggregations. Platelet aggregations refer to the process where platelets stick together to form a clot. Adhesion is when platelets stick to blood vessel wall. Release is when platelet release substance to help the clotting process. And retractions is when the clot tightens to stop bleeding. Here's a breakdown of the terms. Adhesions. This is the process by which platelets stick to the damaged blood vessel wall, usually to expose collagens or other components. Adhesion is the first step in platelet activation. B. Aggregations. This is the correct term for the interactions and binding of platelets to one another. After platelets adhere to blood vessel wall and become activated, they release various factors, cause nearby platelet to aggregate and stick together, forming a platelet plug. C. Release. This refers to process by which platelet release granules containing various substances that helps in further platelet activations and aggregations. D. Retractions. This is the process where the platelet plug contracts after it forms, helping to stabilize the clot and reduce the size of the wound. So, aggregation is the term used for platelet binding to one another, which is critical in forming a stable clot. The process of coagulation involves several stages from the formations to dissolution. Here's a brief overview of main stage. 1. Vasospasms reduce blood flow to the area. 2. Platelet plug formations. Platelets stick together to form an initial plug. 3. Coagulation cascade. Activations of clotting factors leading to fibrin formations, stabilizing the clot. 4. Clot reactions and repair. The clot contracts and the vessel heals. 5. Clot dissolution. The clot is broken down by plasmin and removed from the body. This entire process ensures the bleeding stops quickly, but the clot doesn't stay in place longer than it necessary, preventing excessive clotting and potential blockage. That's all I have for today. Did I miss anything? If you have any question, please let me know. I'm more than happy to answer them. If I don't know, I will try my best to find out for you. Also, keep in mind that the information I put together here is the general practice at the moment. As time changes, certain practice may change, and different institutions may have different policies. So please keep an eye out for that. If you like my video and think it's helpful in any way, please share it with your friends, and I shall see you all next time. As always, remember, your blood tells you the story of your health. Thanks for watching. Bye!